For our intervention, we are doing it on diabetes among the African American population. And so for the question, it's what are the ways in which there can be reduction in diabetes among African American population? For the introduction, diabetes is a disease that affects blood sugar. Those with diabetes, their blood glucose sugar levels raise higher than normal, which is hyperglycemia. Type 2 diabetes is the most common form. Those with type 2 diabetes are unable to use insulin properly because their body rejects it. And African Americans have higher risk for developing type 2 diabetes, and they are twice as likely to be diagnosed than non Hispanic whites. And so, moving on to the evidence, when focusing on research for diabetes among African American populations, there was significant increase of success with interventions involved. And then, in a study done by Spencer et al. From 2011, there were 3 primary activities for the intervention group, which included education classes, home visits, and clinic visits. And those results were that they saw an improvement of hemoglobin A1C levels by 0.8%.
For the intervention, participants will be identified from Truman Medical Center through medical records. Medical records will identify participants through a diagnosis of type 2 diabetes or those that show signs of being at risk for type 2 diabetes. Pre and post surveys will be conducted to identify influencing factors and evaluate the progress made throughout the intervention. Education classes on nutrition, exercises, and overall wellness will be conducted to increase knowledge and awareness of diabetes. Free testing and physical exams will be provided to increase the use of testing facilities and awareness on their status of their type 2 diabetes. Support groups will provide a support system for anyone struggling with their diabetes. The setting and population include low-income African Americans diagnosed or at risk of type 2 diabetes that go to Truman Medical Center for medical services. The education classes will be held in the target community in the community centers or local schools and churches. The free testing will be held at Truman Medical Center, and the support groups will be held within the community at the community center or local schools and churches.
For our evaluation and outcomes, we will be evaluating medical records and testings. A baseline on the status of the patient's blood glucose levels will be received during this time. With access to medical records, there will be an easier way for the patient's records and information to be given to other physicians or even doctors if they need it. By providing an increase on dieting and physical lifestyles, participants are able to decrease complications or symptoms of diabetes. With flyers and surveys that will be handed out, participants are able to increase their knowledge and even learn more about a healthier lifestyle and ways to improve their health and diabetes. When it comes down to our conclusions, we will be hoping to implement the knowledge of African Americans on living a healthier lifestyle. It will help reduce the prevalence of diabetes. Support groups are able to help the participants share thoughts and ideas that could help not only themselves, but others during this process. By being able to compare their old lifestyles with their new, participants are able to share the knowledge and lower the rates of diabetes in African Americans by changing their lifestyles as well.